Bismillah ar-Rahman ar-Rahim. Our lecture today will be about hepatitis viruses, hepatitis A, B, C, D and E. These viruses are grouped together by their pathological effect on the liver. So this group of viruses are example of pathological classification of the virus. Previously, viral hepatitis were classified into infectious viral hepatitis and serum viral hepatitis. Under infectious viral hepatitis, we have hepatitis A, and under serum viral hepatitis, we have hepatitis B. Other than these two viruses, it was called non-A, non-B virus. Today, under infectious viral hepatitis, we have hepatitis A and hepatitis E. Both of these viruses are transmitted by enterically or through enterically route. In case of serum viral hepatitis, we have hepatitis B, hepatitis D and C. These viruses transmitted by parenteral route. Types of hepatitis viruses, the A, B, C, D, E, and comparison between the source of the virus, route of transmission, chronicity, and prevention. Both hepatitis A and E, the source of viral infection is the feces. The route of transmission in A and E is by fecal-oral route. Both of them, the hepatitis A and hepatitis E, there is no chronicity or there is no chronic infection with these two viruses. The prevention in case of hepatitis A is by pre and post exposure immunization, whereas the prevention in hepatitis E is by ensure safe drinking water. In case of hepatitis B virus, the source of viral infection is by blood and blood product or through body fluids. The route of transmission is by percutaneous and permucosal route. There is a chronicity in case of hepatitis B viral infection. Prevention of hepatitis B virus infection is by pre and post exposure immunization. In case of hepatitis C, the source of virus is blood product, body fluids. Route of transmission is by percutaneous and permucosal route. There is a chronic or chronicity with hepatitis C viral infection. Prevention is by blood donor screening and risk behavior modification. Hepatitis D or delta agent, the source of virus is blood derived and body fluids. Route of transmission, percutaneous permucosal route. There is a chronicity in infection with hepatitis D virus, and the prevention again pre and post exposure immunization plus risk behavior modification. Now we will start with hepatitis A virus. This is the EM picture of hepatitis A virus showing the honeycomb picture of this virus. The morphology is resemble honeycomb. Hepatitis A virus, naked RNA virus, previously related to enteroviruses formerly known as enterovirus 72 and was classified as the third genus in Pacornaviridae family after that, and now it's separated in its own family as heptovirus. There is one stable serotype in hepatitis A virus, and the other characteristic of hepatitis A virus is difficult to be cultured in vitro and in vivo. The clinical feature of hepatitis A viral infection: incubation period 1 month, 30 days, range between 15 to 50 days. Jaundice, the occurrence of jaundice is related to the age group of infection. If the age is below 6 years, the percentage of jaundice is below 10%. If the infections occur between 6 years and 14 years of age, the percentage of occurrence of jaundice between 40 to 50%. If the infections occur in those over 14 years, the percentage of occurrence of jaundice is between 70 to 80%. Complication: fulminant hepatitis, cholestatic hepatitis, relapsing hepatitis, but there is no chronic sequelae. Chronic sequelae, there is none in case of hepatitis A viral infection. This is a typical serological course of hepatitis A infection in this slide. In y-axis we have the titer of different markers, and in x-axis months after exposure. With the appearance of the symptom after 1 month of the exposure, the symptom of the viral hepatitis will begin. With the appearance of the symptom, the enzyme, the liver enzyme, the ALT, increase to reach its maximum level around 1.5 months after exposure. Then it starts to the declining, with the disappearance of the elevation of the liver enzyme associated with the decrease in the symptom and disappearance of the symptom of viral hepatitis. The other marker is the IgM anti-hepatitis A virus. It starts after 1 month of exposure, reach its maximum level in 3 months after exposure, and then decrease to disappear in 5.5 months after exposure. The total anti-hepatitis A antibody start after 1 month of exposure and then elevated and continue to rise up with the course of the infection. The early detection of hepatitis A viruses can be done by a stool sample. We can detect the virus in stool after 2 weeks of exposure, and the detection, it could be done by electron microscopy or, depending on PCR, looking for the genome of the virus in the stool. So the early detection of the virus, it can be started earlier in the course of the infection after 2 weeks of the exposure. Hepatitis A virus transmission, close personal contact enhance the transmission of hepatitis A. This occurs in household contact, in child daycare center, and contamination of food and water. Infected food handler can spread easily the infection with hepatitis A virus. This map showing the geographic distribution of the hepatitis A viral infection depending on the prevalence of anti-hepatitis A viral antibody. The laboratory diagnosis, as we said, acute infections can be diagnosed by detection of IgM, hepatitis A viral antibody, by enzyme immune assay. Past infection depending on the IgG, anti-hepatitis A viral antibody, by enzyme immune assay. Cell culture is difficult and not routinely performed. Direct detection by EM and PCR of feces can be done to detect illness earlier than that of serology. Hepatitis A vaccination strategy. This can be given to persons travel to high endemic area like travelers, or those carry a highest attack rate, those below 5 to 14 years of age. Children serve as a reservoir of the infection. Hepatitis A prevention immunoglobulin can be pre-exposure given to traveler to intermediate and high endemic region, and post-exposure within 14 days of the exposure to hepatitis A virus. Routine could be done to or given to household and other intimate contact, or selected situation in case of daycare center or those common source of exposure like food prepared by infected food handler. Now we will talk about hepatitis B virus. This is an EM picture of hepatitis B virus showing more than one morphological appearance of hepatitis B virus. It could be appear as a complete virion called dam particle, or appear as a filamentous shape, or as a dense small morphology. All of these represent that hepatitis B virus could be occur under EM in different morphological features. The hepatitis B virus, it is an envelope, incomplete, double-stranded DNA virus. In the envelope, we have hepatitis B surface antigen as a glycoprotein. Under the envelope, we have the hepatitis B core as capsid protein. It is another antigen. And inside the core, we have the hepatitis B E antigen, represented the viral polymerase. And against the hepatitis B antigen, we have the anti-hepatitis B E antibody, and against the hepatitis B core, we have GM and IgG anti-hepatitis B core antibody, and against the hepatitis B surface antigen, we have the anti-hepatitis B surface antibody. The hepatitis B virus virological aspect, it is a double, as we said, it's a double-stranded DNA virus. The positive strand is not complete. The virion, the complete viral particle, is called the DAN particle. It is about 42 nanometer in diameter, and the other small condensed area shown by the EM is a 28 nanometer electron dense core, represented the hepatitis B core antigen plus hepatitis B E antigen. Sometimes the virus appear as a filamentous shape under the EM. This represents the coat of the virus. It is about 22 nanometer. Free particles contain the hepatitis B surface antigen. At least we have 4 phenotypic or phenotypes of hepatitis B surface antigen are recognized in hepatitis B virus. So hepatitis B virus can be classified into 4 phenotypic types according to the hepatitis B surface antigen. The ADO, ADR, AU, AYR. This depending on the antigenic determinant present in the hepatitis B surface antigen, A, D, W, Y, and R. So the combination, the 4 phenotypic combination of the antigenic determinant present in the hepatitis B surface antigen, it will be ADO, this one phenotypic type, ADR, AU, the 3rd phenotypic type, and the 4th is AYR. There is one or single serotypic type of hepatitis B virus according to the hepatitis B core antigen. It has not yet been possible to propagate the virus in cell culture. The hepatitis B clinical feature, the incubation period, will average 60 to 90 days. The occurrence of jaundice, if the infection occurs in those under 5 years, is below 10%. If the infection occurs in those 5 years and above, the percentage of occurrence of jaundice will be between 30% to 50%. The acute case fatality rate in acute infection is between 0.5 to 1%. A chronicity or a chronic infection with hepatitis B, if the infection is occur under 5 years, it's between 30 to 90%. If the infection occurs in 5 years and above, the chronicity is between 2% to 10%. Mortality rate from chronic liver disease in hepatitis B viral infection is between 15 to 25%. The spectrum of chronic hepatitis B diseases, one could be present in form of a chronic persistent hepatitis, usually asymptomatic, diagnosed by serological markers, or a chronic active hepatitis, symptomatic with exacerbation of hepatitis, or presented with cirrhosis of the liver, or in form of hepatocellular carcinoma. This represents in this slide the typical serological course of acute hepatitis B virus infection with recovery. Infected and recovered from hepatitis B virus, this will be the typical serological course. Again, in x-axis we have weeks after exposure, and in y-axis is the titer. The first marker will be appear in infection with hepatitis B virus is the hepatitis B surface antigen. It's appear after 4 weeks of exposure, associated with the appearance of hepatitis B E antigen. So both the hepatitis B surface antigen and hepatitis B E antigen appeared after 4 weeks of exposure. The peak of hepatitis B surface antigen reached in 12 weeks after the exposure and disappear in 24 weeks after the exposure. After the 32 weeks of the exposure, the anti-hepatitis B surface antibody it will be appear. In case of hepatitis B E antigen, it start to appear in the 4 weeks after exposure, and in 12 and 13 or so weeks after the exposure, the hepatitis B E antigen it will be changed to anti-hepatitis B E antibody. The symptom of the infection with hepatitis B virus it will be started after 8 weeks of the exposure, 2 months, and it will disappear after 20 weeks of the exposure. The IgM anti-hepatitis B core antibody, the IgM anticore, it start in 6 weeks after the exposure, reach its maximum in 16 weeks after the exposure, and then disappear in 32 weeks after the exposure. The total, or the IgG anti-hepatitis B core, to start again in 6 weeks, the total, and reach its peak in 16 weeks and continue flat in the course of the infection. This is the typical course of the or typical serological course of infection with hepatitis B virus and recovery. In this slide is the progression to chronic infected with hepatitis B virus and pass to chronicity. Again, the first marker will be appear is the hepatitis B surface antigen and the hepatitis B E antigen, and the hepatitis B surface antigen it will continue through the whole weeks of exposure if the infection is passed to chronic, and of course the hepatitis B E antigen it will continue for a long time before changing to anti-hepatitis B E. But the marker of the passing to chronicity is the IgM. IgM begin at 6 weeks, reaches maximum 16 weeks, and disappear after 32 weeks of the exposure, with the total anti-hepatitis B core being started again 6 weeks and reach its maximum 16 weeks and continue in a flat plateau scheme. This is the outcome of hepatitis B virus infection by age is beyond your scope. This world map represents the geographic distribution of a chronic hepatitis B viral infection. And the concentration of, in this slide, the concentration of hepatitis B virus in various body fluids. The highest concentration of the virus it will be in the blood, serum and wound exudate. The moderate concentration of virus it will be in semen, vaginal fluid, saliva. Low or not detectable, low in urine, feces, not detectable in sweat, tears, breast milk. The mode of transmission with hepatitis B virus sexually, parenterally, and perinatal mother who are hepatitis B E antigen positive are much more likely to transmit the infection to their offspring than those who are not positive. The diagnosis, there is a battery of serological tests are used for the diagnosis of acute and chronic hepatitis B infection. The hepatitis B surface antigen used as a general marker of infection. hepatitis B surface antigen, general marker of infection. Hepatitis B surface antibody used to document recovery and or immunity to hepatitis B viral infection. The anti-hepatitis B core IgM marker of acute infection. The anti-hepatitis B core IgG marker of past or chronic infection. The hepatitis B E antigen indicative of acute replication of the virus and therefore infectiveness. The presence of hepatitis B E antigen mean high infectiveness and the replication of the virus. The anti-hepatitis B E mean the virus appearance of anti-hepatitis B E mean the virus is no longer replicating. However, the patient can still be positive for hepatitis B surface antigen, which is made by integrated hepatitis B virus. The hepatitis B viral genome, the DNA, indicates active replication of the virus and is more accurate than the hepatitis B E antigen, especially in case of the escaped mutants. This use, the genome of the virus, used mainly for monitoring the response to the therapy. The treatment with for hepatitis B virus, as we take it in the antiviral agent lecture, it will be interferon, lamivudine, adifovir, entecavir. Successful response to treatment will be result in disappearance of hepatitis B surface antigen and the hepatitis B genome, the DNA, and the seroconversion of hepatitis B E antigen to anti-hepatitis B E antibody. This is mean a successful response to the treatment. The disappearance of hepatitis B surface antigen, disappearance of hepatitis B virus DNA, the genome, and the conversion, the seroconversion of hepatitis B E antigen to antibody. Prevention, there is a good vaccination program for the prevention of hepatitis B virus. It's through highly effective recombinant. The vaccine used for hepatitis B virus is a recombinant vaccine available and given to those are at increased risk of getting infection with hepatitis B virus, like us, the medical staff, the doctors, the nurse, and those lab workers are dealing with serum and blood samples. Hepatitis and also routinely to neonate as universal vaccination in many countries. The hepatitis B immunoglobulin may be used to protect persons who are exposed to hepatitis B. It is particularly effective within 48 hours after the incidence. Other measures: screening of a blood donor, blood and body fluid precautions. Now we will talk about hepatitis C virus. This slide represents a picture of hepatitis C viral genome. It is a positive sense genome, begin with 5' and with 3', with different gene representation on this RNA genome in different color. The gene present near the 5' end is the structural genome, of the gene of the genome, and the gene present toward the 3' end of the genome is the non-structural proteins, the enzymes involved in the replication. So near the 5' we have the gene for capsid protein and core, envelope protein next to it, E1 and E2. Then we will become with the NS, the non-structural protein 2, non-structural protein 3, as a protease enzyme, helicase enzyme. Then we will pass to RNA dependent RNA polymerase as a non-structural protein 5 toward the 3' end. There is a hyper variable region between the E1 and E2 gene. This hyper variable region made the genome of the hepatitis C virus unstable, and this instability of the genome of hepatitis C virus due to the presence of hypervariable region in this area make difficulty to produce a good vaccination program against this viral infection. Hepatitis C virus, genome of flavivirus, positive stranded RNA genome, around 10,000 bases. There is one single reading frame of this genome. Structural gene, as we said, near the 5' end, and the non-structural genes at the 3' end. It is an envelope virus, the virion size between 30 to 60 nanometer in diameter. The clinical feature of hepatitis C viral infection: incubation period شهر ونص, 6 weeks to 7 weeks. Jaundice, the occurrence of jaundice between 30 to 40%. Chronicity, high percentage of chronicity, around 70%. Persistent infection between 85 to 100%. A chronic hepatitis C infection: spectrum of the chronicity of infection with hepatitis C is the same as the chronicity of hepatitis B infection. All the manifestation of chronic hepatitis B may be seen, albeit with a lower frequency. That is to say, it could be presented with the chronic persistent hepatitis, chronic active hepatitis, liver cirrhosis, and hepatocellular carcinoma. The typical serological course with infection with hepatitis C virus, again in the x-axis is the months after exposure and the titer in y. The symptom, it will be appear after 1.5 after the exposure, after the incubation period, with the appearance of the symptom associated with the increase in the liver enzyme, the ALT, with the disappearance of the symptom after 4 months or so of the infection, associated with the decrease in the level of the ALT, the liver enzyme. The anti-hepatitis C viral antibody, it will be appear after 1 month of the infection, 4 weeks of the exposure, and reach to the detectable level after 2 months of the exposure to the 2.5 months of the exposure. So it is a bit little late to be depend on the presence of anti-hepatitis C virus as a marker of the infection with hepatitis C, because it takes about 2 months to 2.5 to reach the detectable level to be can be detected by the serological test, and started after 4 weeks of the infection. Risk factor associated with the transmission of hepatitis C virus: transfusion, transplant from infected donor, injecting drug use, hemodialysis, accidental injury with needles or sharp object, sexual and household exposure to anti-hepatitis C positive contact by multiple sex partners through sexual intercourse, birth to hepatitis C infected mother. This slide just to show you that there is a high prevalence of anti-hepatitis C virus in Egypt in blood donors. Laboratory diagnosis: depending on hepatitis C viral antibody, generally used to diagnose hepatitis C virus infection. Not useful in the acute phase, as it takes at least 4 weeks after infection before antibody appear, and to reach the detectable level it needs 2 to 2.5 months after the exposure. Depending on hepatitis C genome, the RNA virus technique are available, like the PCR, may be used to diagnose hepatitis C viral infection in acute phase. However, its main use in monitoring the response to antiviral therapy. The hepatitis C viral antigen by EA, by enzyme immune assay for hepatitis C virus antigen, is available. It is used in the same capacity as looking for the genome test, but it is much easier to carry out. So if we want to diagnose hepatitis C viral infection, we can depend on the detection of the antigen of hepatitis C virus, or by looking for the genome of the virus by using PCR. treatment, we can use the interferon or the ribavirin. Ribavirin is used as antiviral agent against hepatitis C viral infection. The prevention of hepatitis C, good blood screening of blood and organ and tissue donors, high risk behavior modification, and blood and body fluid precaution. We can prevent hepatitis C by this procedure. Now we will talk about hepatitis D, the delta agent or the delta virus. It is a core of RNA genome with the delta antigen covered with the hepatitis B surface antigen. The hepatitis D virus, the delta agent, is a defective virus. We must remember that the delta agent is a defective virus, similarity to those viroid in plants. The agent consists of a particle about 35 nanometer in diameter consisting of delta antigen surrounded by an outer coat represented by hepatitis B surface antigen. The genome of the virus is very small and consists of a single strand RNA. The hepatitis D viral infection, a clinical feature, it could be form of co-infection. The both hepatitis D and B virus infected the person at the same time. It's called co-infection. It's presented as a severe acute disease with low risk of chronicity, whereas other type of hepatitis D clinical presentation has a super added infection. The patient having hepatitis B virus and the hepatitis D virus occur as an added infection. It's called super infection, usually developed in a chronic form as presented as a chronic hepatitis D viral infection with high risk of severe chronic liver disease, may sometimes presented as acute hepatitis. The hepatitis D virus mode of transmission occur through the percutaneous exposure, injecting drug use, per mucosal exposure, and could occur through sexual route. This is the geographic distribution of hepatitis D viral infection. The hepatitis D prevention. The prevention of hepatitis B and D co-infection is through pre and post-exposure prophylaxis to prevent hepatitis B viral infection. If we prevent hepatitis B viral infection, we will prevent the co-infection with D, of course. If we want to prevent the hepatitis B virus, hepatitis D virus super infection, is through education to reduce the risk of risky behaviors among persons with chronic hepatitis B viral infection. Now we will talk about hepatitis E virus. This is the EM picture of hepatitis E virus. The hepatitis E virus is a calcivirus, an envelope RNA virus. It's between 32 to 34 nanometer in diameter. It is a positive strand RNA genome. It's about 7.6 kilobase in size, the genome of this virus. It's very labile and sensitive. Can only be cultured in the years. The hepatitis E clinical feature, the incubation period, will average around 40 days, a range between 15 to 60 days. Case fatality rate between 1% to 3%. Illness severity increase with the age of the infection. Chronic sequelae, there is no chronic infection with hepatitis E virus. This slide showing the typical serological course of hepatitis E viral infection. In x-axis we have weeks after exposure and the y is the titer. The virus appear in stool after 3 weeks of the exposure, and the patient remain secreting the virus with the stool for 7 weeks after infection. The symptom of the infection with this virus started after 5 weeks of the exposure, with the appearance of the symptom associated with the increase in the liver enzyme, the ALT, and as the symptom disappeared, the liver enzyme, the ALT, decreased to undetectable level about 9 weeks after the exposure. The IgM anti-hepatitis E virus start to appear after 3 weeks of the exposure, reaching its maximum level in 6 weeks after exposure, and decrease to disappear gradually with the course of the infection. The total, or the IgG anti-hepatitis E virus, start after 3 weeks of the infection and start to elevate continuously with the course of the infection. This was the typical serological course of the infection with the hepatitis E virus. The epidemiological feature of the hepatitis E viral infection: most outbreaks associated with fecally contaminated drinking water. Several large epidemics occur in India, China, Africa, or Mexico, this area with bad sanitary condition and bad water source and supply for the people. There is a minimum person-to-person transmission in hepatitis E viral infection. This map represented the geographical distribution of the hepatitis E: China, India, Mexico, and Africa. The prevention and control measure for hepatitis E viral infection: avoid drinking water of unknown purity, and there is vaccination. The vaccine of hepatitis E is still in studying and under testing procedure, not available till now. This is the end of our lecture, and thank you.